I'm Orlando Cruz, and this is kind of what we're doing today. I think I'm about the only, I haven't seen another one, let me put it that way, of the 6,000 broker agents in the area give classes on how to use the government's own website. This is not carrier specific, so now you're going to see names up there, but they're on, as you can see, .gov. That's the most important thing it is their own site. All of the carriers that are authorized to provide or have a Medicare prescription drug plan via a standalone or what they call MAPD, which is Medicare Advantage prescription drug plan, when it's combined together, what a lot of typically people call all-in-one. But I go directly there because there's no confusion. When you see names, I'm not advocating any one of them. What you're going to see is I'm going to point out the literature and the notes, the things that you need to say, oh, okay, that's what we're talking about. Because as you add prescriptions, as you do things, it'll change. What you're going to see here is anyone who will join the Medicare ranks should do before they get on to Medicare. And those that are on it already in October, you need to do this. I'll tell you one more thing. Last year, during the season, I spoke to about 300 people. About 30% of them that were already on Medicare needed to change their plan because simply it was changing from, let's say perhaps they were paying $10 a month, it might be going up to $50 a month. Same doctor, same prescriptions, same pharmacy, but the plans change. Everything changes. Your needs will change too. So I'm going to treat this as if you were brand new. No filters. In other words, this is what I have. I'm looking for a plan that's going to help me with my prescriptions. All right. So the first box I'm going to use, it says Find Health and Drug Plans. It's the green box on the left. So hopefully we can tap on it and get the system going. So the next screen that is going to come, all of these prescription drug plans and MAPD plans are based on a geographic area, let's say, of a network, right? The size of a county. So that's why it's asking you to enter a zip code. We are at 85379. So it's going to ask you some basic stuff. These are filter type of questions. When I say filter, meaning if you hit one and it could give you a subset of information that I want the entire bag. Brand new. I don't know at this time if the person has access to LIS or other things. I'm treating it as your low-income subsidy. That's where the government subsidizes some of the prescriptions. So bottom line is, I'm going to say, okay, I'm a regular guy getting onto Medicare. I want to know if the handful of prescriptions and what I need to know about them. So I'm going to say, I don't have Medicare coverage. I'm going to say I don't get any extra help. And yes, I want to add some prescriptions because that's what our class is about today. So the next screen, after you hit continue to plan results, it says enter your drugs. Well, did you know that they're asking you to do drugs, right? Not prescriptions. So instead of saying prescriptions, they have type the name of your drug. Now, if you've ever gone to the doctor and gotten a prescription, I've been doing this for years. I cannot pronounce them or spell them. So, but the government has a great system. So let's pick any prescription. I'm going to use a generic. And if I type the letter L-I, and it starts giving me a drop-down list. Now I'm going to move over here. You see that it starts to see the name. So if you have a prescription, you look at it. It's going to tell you. So I'm going to use a basic one, a common, lisinopril. Now, this is an interesting piece here. You can pick that name. When you see something like this, a slash HCTZ, that means it's combining two prescriptions in one. It's going to give you a dosage for one and a dosage for the other one. So either one that you pick is fine. I'm going to pick the one that has the two, so it gives you a better example of what I'm talking about. So see, immediately start to ask you questions. It comes in a tablet. 10 is for the lisinopril, 12.5 is the HCTC. 20, 25. So that's the combination. So you read, all because the doctor said lisinopril doesn't mean you got to get that detail. The next box, it'll automatically give you the default. The default is 30. But what if he told you to do one every other day? So you put 15. What if he told you, well, take, every 3 months you take, some type of, so you can put 2 months, 3 months, 12 months. You'll see that as a handy tool for many of the other prescriptions that are available. At the bottom, this is another filtering piece. I leave it as a default retail pharmacy. Most people may or may not want to go to a mail order, and the different ways of handling that. So assume that you just want to pick it up at your regular local pharmacy. Right? So we leave that. When I say add the drug and dosage, it automatically places the information here. It allows you to add up to 25 drugs, and on that side out there, you might not see it, it's a little bit small, but I'm going to enhance it here. Drug list ID. That is automatically assigns a number, and I'm actually going to take that and write it down, because if for whatever reason, after I've typed in 20 different prescriptions, the system fails, I can go right back to it. I put the information there 3 months from now. I go back and enter that. It pulls the whole list up. It's very useful because I tell people keep it. Sometimes you're dealing with a husband and wife. One is taking care of the other. They don't always have the prescriptions list in their pockets, in their wallets, purse, or maybe a son, daughter, right? So here's a point of reference for you where they can assist you with this, okay? Let's add another common one, metformin. They prescribe it, it's almost over the counter. But look at this one. This one, things that you need to consciously be aware of. 500 milligrams, 850, 1,000, 500 mg, ER. What does ER mean? Extended release. Sometimes you might have a person that needs 1,000 milligrams. If they give you the 500 and you have to take it twice a day, but you forget half of the time, you might say, the doctor might say, well, you better take it ER. The chances are that it might cost more. So that's why you got to look up, play around with all these situations, right? So I'm just going to use the basic. It automatically assumed that we have 60, 2 a day, if I'm doing 500 milligrams. Right, so all those numbers are important. So we just added those two. Now I'm going to keep this simple. I'm going to just leave those 2 prescriptions there and say, I'm going to, my drug list is complete. We'll go back and I'm going to put some brand names in there so you can see how dramatically things change, okay? But right now, this is just walking you through the basic way. So the first thing is going to come up on the next page. It says, we found 5 pharmacies within 1 mile of 85379 serving the area. Here are some of the common names you have. Now, if you're in a different part of the country, might be different, right? So you start to get familiar with that piece. Now, I'm going to say I want 4 miles. So I just changed that button there, and in ascending order, alphabetical order, right? It's going to give me a list of them. So you want to pick anything. You can pick, let's pick Arizona Pharmacy. Don't know who they are, but just picking one. And let's go, see on the second page they have more, again, in alphabetical order. Some of them might have no idea where they are. You might know that, Walgreens, Walmart, so just pick one. Prices will change. That is the main reason why they allow you to pick pharmacies. Later on I'll explain a little bit more where the company has what we call preferred cost share. In other words, they're working closely with a few of the pharmacies. Pharmacies normally have what they call a national standard network. Keyword standard. So whether you go to this pharmacy or that pharmacy, most likely they'll give you the prescriptions that you have. There's a handful that have these specialized prescriptions that they kind of compounds and put them together that you won't find in most pharmacies. But mostly you'll find on pharmacies like this, they're not building compounds. You got all the standard medicine available that might be available to us. So anyway, there will be a price difference. They call that preferred cost share. In reality, is they're making, again, aligning themselves where they can probably serve you better by giving you a lower cost for your prescriptions. And in their literature and fine print, you'll see. You go to their preferred pharmacy, might be $1. Standard could cost you up to $10 for the same prescription. So that's why this exercise is. I'm just going to do the same thing. Continue to plan results. Again, all the names that you see here, the companies gave to the government. It's not me representing one or another. It's just simply, and I'm not advocating. This is how you get to the information that you need to know before you make selections. Now, over here, you can do these selections. Limit your monthly plan premium, right? That's a filter. Limit your annual drug deductible. That's a filter. Select drug options. So that I'm not looking for filters. I want to share what's available first before I start narrowing it down. Now, what did I mention earlier? There's 23. This is just for prescription drug plans. So when you have a Medicare supplement, or they call them Medigap/supplements, right? Or vice versa, supplement/Medigap. That's when you have original Medicare, you have a supplement to pay what Medicare doesn't cover, and you need a standalone prescription plan by itself. Now, sometimes you can combine with a private fee-for-service Advantage plan, or if you have let's say a group plan that does not have credible prescription drug coverage, that's where you go. 23 of them came up to that. If you go to Yavapai County, Pinal, Santa Cruz, it'll be totally different. Okay, you might see similar names. You might see premiums change. So I'm just going to select that one to see. So far, this is assuming that you have original Medicare and you're looking for a prescription plan. The government puts, according to my selection process, the lowest remainder of the year retail cost. In other words, it's going to give me in an order, and they normally just tally it up. It says that if you join this plan today, so the government never starts a prescription plan in the middle of the month. It will start it on the 1st. So it's assuming that this will start, in this case, August 1st. If it started August 1st, the premium, because all these plans have a premium, will be $20.40, and the total cost for the remaining 4 or 5 months is going to be that for the next 4 months, from October to December. What I'm going to do is just pick this one because the government allows me to select 3 of them. So let's tap that one. The next one in line is called, well, it has a name. And let's pick one down here. So I picked 3. Again, there's 23 of them. So what I did there, it allows me to go to this button right here. Compare plans. It's hard to look at them on a scrolling vertical, so it's going to put it horizontal side by side. So what does it say? It has a great tab over here. It says, and these are the pieces of information that you're looking at, all right? Drug cost and coverage. You'll have the names of the company, how to contact them, that's fine. But this is where we start to get our education. This is telling you no matter whether you take an aspirin or not, for any of those prescriptions that I had there, let's say you had none, you would pay this premium to be on that plan. First thing you're reading, okay? The second thing that you're going to see below, this one does not include the health component, but this standalone plans, all of them have assigned to it the government's maximum amount of deductible, $405. That does not always mean that you're going to pay the first $405. Depending on how they define the plan, they could be applying it to tiers, tier 1 through 5 or through tier 6. A lot of times, tier 1s in common language, normally you're talking about the generics. Brands start at tier 3. So they might say you don't have a deductible for tier 1 or 2, and they might say your deductible starts with the brand. So if you got a brand, you're going to have to pay that $405 first under this plan. If you have a generic, you might not be paying that at all. You're just paying the cost of the prescription. And we'll see that down in the bottom. So the next box you see really starts to tell you the story. Now look how interesting it would be. Under this plan, the total would be $503 if you went to that pharmacy. Remember, we have 2 prescriptions, they're generics. Under this plan, you already see, what, $350 difference? Under this, if you do mail order, they give you the information to see if you want to do mail order with them. $134.50. So some people don't want to do a mail order, and I'll explain how that works. That's normally for prescriptions. A lot of these generics are called maintenance prescriptions, where the doctor can prescribe them for 3 months at a time. They normally do it year-round, but it's 3 months at a time, okay? Why is that important to know? Because sometimes you don't want to even bother to go to the pharmacy if it's less amount of money, and they do a 90-day supply, and you're comfortable having them sent to your house or a safe place, they will. So that's another option that you have there. But they share that information with you. Again, when you're looking to save money, if you're on a budget, prescriptions could be a very strong deterrent. If you don't know what you're doing, for the same prescriptions that you could be paying $102, $134, $503. I'd rather put my $400 in my pocket. That'll at least be one $40 dinner per month. We're going to go down the same sliding screen, right? The government builds into this really great platform. Instead of starting August 1st, let's say, can you picture it if you're starting not in the middle of the year, but January 1st? That's what they just did here. So it gives you an estimate for planning purposes of how much you would pay. This amount here includes the plan's premium. So let me stroll right back up here. If this plan's premium is $26.90 and you're paying $30.03, you subtract the $26, you've basically paid $4 copay. Because typically most of you have your $26 or the premium of the plan deducted from your Social Security check, most likely, or directly from a draft. Okay? But the copay is what you're going to pay at the pharmacy. All right? We're good with that? So it gives you an idea. If you look at, it looks like the plan all the way on the left here, the premium is $20.40. Your copay is $2 for those prescriptions. They're paying about $1 for each prescription. Again, we just use 2 very basic maintenance prescriptions, and you can start to see the difference already. For those that are taking more advanced prescriptions, inhalers, insulin, other brand name, you're going to see a substantial difference to the point that you go, wait a minute, I better take a close look at it, because you will pay anywhere from $50 to $150 more a month. Now you start really adding up the change. Okay? Now, the system, the Medicare's website, they're great. They start bringing you as to, so this company put that prescriptions as a tier 1 preferred generic, tier 1 preferred generic, and it goes down the line. So they're pretty basic prescriptions, no surprises there. I want you to see here another informational box. No restrictions. Quantity limits. It's the only one that has it. So they're going to tell you there's a limit on how many of these you can get on a monthly basis. That amount there, right now, is not indicating anything substantial. But let's say when you get to the opioids, right? Recently, it used to be 90 days. Now they say you can't prescribe it more than 30 days. That means 2 things. You got to go see the doctor 3 times, right? Instead of once. So that's going to affect you on your copays for the doctors if you have one. And also, of course, money there. It also tells you mail order is available or not available. And then this is 5 network pharmacies, 3 network pharmacies. So it sounds like they have alliance with 5 of them. That one has 5, 3. When they say network, meaning it's a non-standard. They got a preferred core share with 5 of them. Pretty neat so far, right? If you wanted to change anything, you're not stuck. I'm going to scroll all the way back to the top. You don't see it here in small letters. These were all the steps that we went through. Okay, so your plan results, refine your plan results, select pharmacies, enter drugs. I'm going to go right up to enter drugs. So are you curious about any particular drugs?
I am.
You have one that you would like to share?
Letrozole.
And that's a good, if they tell you a brand, like Prozac or any other one, the system will prompt you if it has a generic. Now you can't selectively pick the generics, okay? You got to ask your doctor if he can give you the generic. Here's an interesting piece. This one only has one version of it. 2.5 tablets, so you don't have to remember that part. The quantity, and let's say that, okay. So I'm going to say add that one. If there's a generic or some change to it, it will prompt me. It did not. So we'll add that, and note that it adds them in alphabetical order. So it's not the last one entered on the bottom, okay? So when you're checking your list, and by the way, all of this, not only is it saved, it can be printed, it could be, this is good for you and your doctor to have consultations. So a lot of people come to me and they say, I think I'm going to be off of this in 2 months. And they're changing me. You can play around. This is something you can talk to the doctor about. Okay. Let's say, hey, we mentioned Prozac. It's telling me, I'm going to pick the whatever it says there. So I hit that. Oh, there it is. A lower cost generic is available for the drug you selected. Use the lower cost or continue with the brand. Okay? So I'm going to say pick the generic. So far that way. So let's add another one. Let's add one Creon. Very, not common. Creon comes in all these units. So let's pick, this is, I think, when have to do with the enzymes and the pancreas. So very rare. 90. I'm going to add it and see if it tells me, what does it say? Okay. Did it add? It added generic not available. Right there. Now, I don't know if any of you stay up late. Unfortunately, I do. And I hear them advertising all type of stuff. And they say, do you feel this way? Do you feel that way? And I feel like, oh my God, I think I need this. And I started. So, I don't know. Just think of anything that you've seen recently being advertised and you can start adding it. So here's one that I was hearing for a while, Invokana.
Oh, yeah.
So I'm just like, oh no, what is that? So I add that. Just add whatever it says there. If you take inhalers, now here, in inhalers, people say, I take a puff. What does that mean? So it comes in these type of units, 160, 4.5, 80, 4.5, and then, how is it packaged? Do I get a 6 gram or a 10.2 gram? And the people are looking at me. If I'm on the phone, they're like, I can't see them, but I can hear their expressions. Huh?
Yeah.
What is that? I don't know what you're talking about. I take 2 puffs, one in the morning and one at night, or as needed. Okay? I don't have anything on my system here that says it's needed. So, pick one. Right now, okay. So we added, we have 7 prescriptions so far. I'm just going to continue, and we can add others, but this is just, again, I'm adding those prescriptions so it shows you how that the selection at the end changes. It should tap certain things like maybe the donut hole and the deductible, which we didn't do before. I'm going to leave the same pharmacies there. You can always change it, kind of try to balance it out. Same prescription plan. So I'm going to say continue. And we're back to the screen. So guess what? The players changed. This particular company, telling you this much. Look at that number. The next one, look at the company behind it. That's the name of the plan, but so don't get confused, right? And let's pick one more. Let's say another one here. All right. Pick one of these. Okay. And that's how that would work. So look what happened. If you go to this particular pharmacy, it seems like those prescriptions are not being handled by them. So save yourself the shocker. That's why you do the analysis first. More in line would have been if you went to this company, or you did mail order. Under this plan, this, again, they're not in the running this. So see how it cost them out, okay? Now, what I wanted to drive back at this particular one here. On this company, all right, I'm gonna make sure you see remember that first chart that I told you? Premium, deductible. Remember the first time we went through this, the premiums were different, and each one of them had a $405 deductible. But none of those three companies came up on this selection of prescriptions. These three came up. Again, you see how it drastically changed. Now here, it brought up things that it didn't bring up before. This plan had a deductible. The government gives you a beautiful marker here in color, it says in blue, that the deductible was met. It's a $100 deductible. That's why you see that month number 1 has $284.21. Month number 2 has $184 because the first month had a $100 deductible built in there. You reach the donut hole. Those that came to the class know that the donut hole is when you hit $3,750 of cost between you and the company. Now it goes to a standard premium. So it's like 33%, forget the percentage, like 33 and 35 or 45 for the brands. So you're going to pay between $3,750 all over up to $5,000. You're in the donut hole. You're going to pay more. When you hit the catastrophic level, and it's somewhere in that line, it went down. So see, this is 5% of the total cost of that prescription. So see how everybody does this differently? Now, let me show you what happened, why they're doing it. Creon, a preferred brand. Now you know it's going to hit the deductible. This one, this is Prozac. They have it in the generic version, tier 1. They have it as tier 2. They have it as tier 1. Invokana is a tier 3 brand for all three of them. This one is a tier 2, tier 1, tier 1, and tier 3. So see, immediately there's changes. Generally speaking, the tier names are very similar but not identical. You're going to find that most companies use tier 1, they'll say it's a preferred generic. Tier 2, a non-preferred generic. Now, how they price those two, they might price it $1 for one company, the other company might price it for $0 or $1.50. 23 companies have their own tier. And their own formulary. Formulary is tens of thousands of prescriptions. As you see, one prescription can have, and I didn't put it up there, it could be in tablet, it could be in capsule, and each one can have different dosages. It can have ER. So one prescription can have a variation of 15 different types.
So get it right when you punch it in.
So it gets this mixture of stuff. And again, they say, okay, I'm going to put this one here, this one here, this one here. Largely because what they're doing is they're going out and dealing with the pharmaceutical and the pharmacy to get a price deal. So they can cost it, and sometimes they'll cost differently. I'm going to do something here which they share. They just don't make it apparent right away. See this little box here says View Drug Cost Summary. It'll throw me in another window here. I'm going to change it to the one that says, but I'm just showing you what they think that costs. So that Creon prescription is a $900 prescription under their pharmacy. Let me do this. I'm going to do because that pharmacy is not as common, but here's a pharmacy that's a little more common to you, right? The Walmart pharmacy. They're saying that this prescription technically costs $800. This is called this Invokana $471. Then what they do is, based on the level, it's not totally a question mark, but here's what they paid. So they're going to charge you $47 for that prescription. See how, again, that's why this is not about, again, not about picking a plan right now. It is about you understanding how it's all put together. So this, back to this piece here, it tells you when you fall into different categories, okay? And it's a planning tool for you. Again, it does the same thing on the bottom, tells you the chart where things are. I added prescriptions and you know, let's do the following. I'm going to go to the back. I'm going to eliminate a couple of them. And again, you'll see how it changes. Because you might be on Creon or you take it for 3 months. I doubt it, but once you're on it, it's kind of like that heavy stuff. But let's say Symbicort. I'll take those two off. You no longer need it. So you enter the prescriptions. You can remove it from there. So I'm going to go right there and remove Creon. And I'm going to move Symbicort. Our drug list is complete. I want to reevaluate. The doctor said, hey, you're doing good. You've been exercising. You no longer have to take these prescriptions. All right, so we move right along to where we were. And then after that, if there's any questions, I'm going to move on to, real quickly, to the Medicare Advantage plans that combine the prescriptions. All right? It's going to be very similar. So we went over there and look. Once again, things shuffled around. I knocked those two out. So this came up, kind of the leader. This one came up. We had not seen this one here before. Now, several of the companies have multiple plans. So don't get confused and say, no, this company, because they have 3 different plans. That's the enhanced there. See, this is by this company. And some of them you can go direct. You can use an agent or a broker. And some of them you have to go directly. Now, my advice to you, because hopefully you knew this, is you're going to pay the same amount of money for that plan whether you use it or not, whether you do it yourself or you get somebody to help you with that. Agents and brokers cannot solicit you to say, hey, I'll do this for you. You can ask them to do it for you, and they will. They get paid by the company. So a good broker, non-captive agent, I mean, captive agents are fine, but non-captive agents, like brokers, if they're licensed with many companies, they can give you, this is what the government wants. If you're only working for this company or that company or that company, you can only offer that, when that may or may not be the right plan for you. Last 2 months ago, I did an analysis for a young lady. Was paying about $85. I don't think it was that plan. Okay, so $85. She had 3 prescriptions. On average, she was paying $100 a month. She asked me to do the the analysis. It turns out that there was another plan with the premium and the copays total $20. So she was paying $80 more a month. $80, $960 more a year. And bittersweet, right? What she told me was, I thought that if you paid top dollar, you get the best plan. It's not that way. They're constructed based on formulary, so you need to look at. And again, I understand that you might not know what prescription you're going to be in the future. You work it with what you have now.
You can change this every year, right?
Every year, there's an annual enrollment window. The new plans come out. I tell people, go do this exercise. If you don't have, if you're doing it yourself, you can do it now. If you're working with a broker, hopefully they do it any time of the year. They have your profile. So instead of, you can call the 800 number you see on the TV, or you can call the person up and say, hey, I got this new one or no change. They look it up, do this exercise, and they say, you know what? You got to go from here to there if you want to save this. You should have that session. It's a 15-minute, 5-minute call that the person do the work and then tell you what they need to do. That's just that guide you. I did not tell you. All right. Now, I'm going to go back and earlier in my session, we just did these are standalone prescription plans. 69% of the people in Maricopa County have an Advantage plan where they're combining the medical services and the prescriptions themselves. You would be selecting this box, which is what I'm going to do now. I'm not going to select this one so we don't have too many plans up on the board. And let's take a look at those prescriptions. Most of these plans that I showed there may or may not have a premium, okay? So this company has a premium. It's saying this is the cost if you did today. See now, a good example, this company has multiple plans. Then you got this one. And these are others, and I want to use, all right, so I have to change the screen here to show you that view all 20, because the plan that I wanted to select did not come up there. This company, again, 2 different plans, right? Now, think you were, this one was the one of interest. See the difference? This has a premium of $35. This one has a premium of $0. They're both HMOs and they're both Advantage plans. And they're both from the same company. But there's only one active at a time, right? So what I'm going to show you here, based on that prescription selection that we have so far, how it's treating things. So it's going to do the same thing that we did with the prescriptions. It puts them all side by side. So you got 3 companies there side by side. The first thing, because it has medical coverage, it will show you the overview. It has this. On the other screen, it just went directly here because it doesn't have a health, it didn't have the medical side component, but you do have it on yours. I'm not going to discuss the medical side. I'm going to show you what the prescription is on it. So under this particular plan that has a premium, the other 2 do not. Well, I'm sorry. That one has, this one does not. This one has a $100 deductible. The other 2 do not. On this plan here, the family of prescriptions that we picked up, the mail order is this amount, you won't mark that amount. Under that plan, Walmart is difference, mail order here, and then you can see it on the far right. Now, this is the first step that you do when you're doing an analysis for your type of plan, because you need to look at doctors, you need to look at other things that might be as equally as important. But if the plans have the same guidelines for you, you find the same resources that you need, like the doctors and other things that you might be interested in, and you're looking at prescription drug costs, well, you might be looking, you might consider this piece be the difference. Why? Well, if you're interested in saving some money, well, I'd rather take this, pay that versus this. You have a particular set of prescriptions, which makes a particular set of combinations. Normally the first step. I opened the class by telling you, out of the 300 people that I saw, about 30%, I kid you not, had some type of change. We do retirement services, and we get a glimpse at sometimes what people on average are earning, or bringing in, not earning. And if you had that opportunity, consciously, I can't be suggesting, hey, listen, you got a $100 room here, $200 a month. You cannot be taking hits and increases that would stretch you to the point that don't have money to eat. So it's important, whether it's you're saving $10 or $100, this is a free exercise. Just do it. If for yourself, your neighbor, most of us, whether you have parents, I'm Medicare eligible this year, so my friends all ask me the same question. And these include doctors and you name it, people who, they say like, oh, can you check this out for me? Do it. There's nothing wrong with it. You'll find, the best thing you can find is like, you're good to go. What you had, you made a good selection. If not, you have an opportunity to change it. You don't have to change it. The window's coming up, and then you make the decisions. A lot of my snowbirds, you should see, I've been licensed in a number of states, Florida one of them. So in Florida, some of these plans, they almost gave you they got all these huge benefits. Come over here, or they move to like Yavapai County, and all of a sudden find that they moved from over there to save themselves cost of living and everything else, and all of a sudden now they're hit by $200 and $300 extra a month on medical costs that was covered in the area. So again, I think it's a very important type of thing. I think I've talked enough. Well, thank you again. Appreciate.
Excellent.
Thank you. Appreciate that.